two awesome people with me today, and I'm going to have them introduce themselves. So I'm going to start with you this time.
All right. John Hofer, I'm the Executive Director of the Provident Health Foundation.
All right. And you?
I'm Carrie Ann Lesbrance. I am the Executive Director for the Prevention Services Department at the Menominee ISD, where we have the Healthy Youth Coalition and Communities That Care Coalition.
Wonderful. So glad to have you guys in with me today.
Thank you for having us.
Yeah, and we're going to dive right in. You want to do that?
Let's dive.
Let's
right.
dive. Okay, so Carrie Ann, what is HYC and CTC, and how do you work to improve community health?
Sure, good question. I think there's a little bit of confusion in the community now that we have two coalitions in our department at the ISD. Healthy Youth Coalition is our youth-led, youth-driven coalition dedicated to promoting healthy lifestyles through youth, drug, and alcohol prevention. And we focus on initiation drug prevention. So initiation drugs are the alcohol, marijuana, tobacco, nicotine products that youth are typically starting out using.
Okay.
And we have 12 different subgroups throughout the two counties that the youth are part of, and they're dedicating to be living the drug-free lifestyle when they join our coalition. We have awesome staff advisors along with our staff that help lead a lot of those subgroups, and they have been doing amazing work since 2001. And then Communities That Care is our newer coalition. It's been in our community since 2017, but again, it's a two-county coalition. We never feel like we can draw the line at the state, and it's more of our adult-led, adult-driven coalition that's kind of doing, we call behind-the-scene work. They're looking at a lot of more the risk and protective factor part of the data, but also, again, focusing on youth, drug, and alcohol initiation youths and what can they do as a coalition to support the youth in the work. Before, we had a lot of adults coming to us like, I want to be a part of what you're doing in HYC. How can I be a part of it? And they never really felt like they fit. And now we have a coalition for them and a lot of help for our schools, too. When they need things or they need chaperones or they need support, we can call on our Communities That Care Coalition to help them with that. Yeah.
That's awesome. Yeah. I didn't really, I knew the two, but I didn't really get the difference.
We have 4 work groups that meet monthly, and it's completely working. They'll tell you it's working meetings too. We have we have an action plan that we work off of, and we get tons of stuff done every year. But we're very proud of them and the work that they do.
That's awesome. So why does Provident support the Healthy Youth Coalition and Communities That Care, John?
Well, Carrie Ann and I have worked together forever, before when I was at the hospital, and now
Continue.
Provident. Provident's endowment from the Advocate Aurora system, when the hospital became wholly owned, tasks us with improving the health of the community. That is a huge move. And we don't do programming. We don't have staff that roll up their sleeves and do the work. We write checks so that others can roll up their sleeves and do the work. And we focus on 3 areas that were driven by the Community Health Needs Assessment. Remember that term because we're going to be talking about it again in the future. And those are mental health, childhood obesity, and substance misuse. And the foundation board early on said, you know what, we're not going to try to fix what's broke. We're going to stop it from breaking again. And so a lot of our focus is on kids, and it's on programs exactly like Carrie Ann's and this HYC and CTC, and that is prevent these behaviors from starting and building that wall between what is good for you and what is not good for you. So they're right in our wheelhouse in terms of who we should be funding as a foundation.
Right, and starting young.
Absolutely. Our local data is showing, before, we've come a long way. In over 10 years, we've moved that age of onset by 1 year, which may not seem like a lot, but that is. It is. If we can prevent that age of use that first time by 1 full year, that is protecting that brain development, delaying or decreasing their chance of addiction later in life. So we moved it from about age 11 to age 12 now, and that's a community-wide initiative that we've done. That not just a coalition. We need community partners. Like Provident Health Foundation is huge financially to us. We truly couldn't be here without them during COVID. Everybody knows that. Everybody shudders at that word, but we didn't know what we were going to do, and when they popped up, it was like like United Way kept us afloat, and then when their funding unfortunately wasn't there anymore, we didn't know what we were going to do, and then Provident came along, and we were able to just kind of keep moving along.
Right.
So we were very excited about that, and our data really does show it keeps moving in the right direction. Our trends are going there, and we kind of say our focus is 12 to 17 years old, but we also know that we got to get the education out there when they're younger too, to prevent it. Our kids are saying, we're being told not to use, but we don't know why we shouldn't use. So we always keep that in the back of our mind. Why are we telling them no? So we got to always be putting that into our activities when we're out there doing it.
Well, not only that, I think now in Michigan, did the DARE program start back up, or is that only in
I know
Wisconsin?
for sure Marinette County is doing it, and some. I'm not quite sure about Michigan yet, but I do know it was revamped and evidence-based now, and we support any type, because like John was saying, programming is also not in our wheelhouse. We wish we had the staff and the funding to do programming in the schools. That's our dream one day, but we don't have it. So we encourage other agencies to be doing that. And actually, we're trained to be told that coalitions shouldn't be doing programming anyway. We do projects and activities, but we support that. We want to help with that. We can find it, recommend it to schools or agencies. We want to make sure that that's happening too, because if they are getting it in schools and it's being reinforced out in the community and hopefully at home, that's a whole tight-knit, thing being protected around these kids.
Exactly.
And same message being told to them.
Exactly. So, it's a new school year.
Yeah.
So new HYC groups are meeting at schools.
Yep.
What can we expect to hear from students in our lives about the Healthy Youth Coalition?
Yeah, we are excited. We actually had the majority of our advisors renew their stipend contract with us. So Provident Health Foundation grants us one large grant to be able to do the majority of the work we do with HYC, and a lot of that is with our advisor stipend and then project seed money on top of that. These kids have no idea what it was before COVID, because anything they wanted to do, we'd say, okay, what fundraiser are we going to do to put that on? Or bake sales everywhere and car washes. And I mean, they probably did one activity a year by the time we got enough funding for it. And now they can just kind of roll out activity after activity without having to figure that out, which is awesome. But so after, knowing we have so many more in place, and maybe it's because that staff member is no longer at the district, they're teaching at another one, then we have to get somebody new. But otherwise, they are ready to go with guest speakers. They have prevention activities already in mind. They have media campaigns they want to do, alternative activities or sober parties are already. So my inbox is already, I'm behind because they have so many great ideas. One advisor in particular said to me, of course I want to renew. It's the best part of my job that I love. And that was amazing, because this is something extra they're taking on in their job roles. And I was, feel like, okay, like, are you sure you can do, thank you for doing it. And to hear that was amazing. But we had 42, I think, activities done between the two counties and 12 schools. So yeah, we asked for at least a minimum of 3. And if they want to do more than that, they can. And a lot of them did. And it's a lot of work to take on between meetings and implementation and planning and all that. And they rocked it last year, and they're going to rock it again this year. And of course, underage drinking is always the number one priority in their action plans, followed by e-cigarette use. The kids are very passionate about nicotine prevention. Nicotine pouches seem to be the next thing popping up right now that kids are really passionate about doing some education on.
Those are those little things, right?
Yes, the little things that are being promoted as like tobacco-free and healthy, or maybe for adult use. But we're kind of figuring all that out with our kids right now. But it's definitely a data point that we're going to be focusing on, and then marijuana use. So the youth are telling us that it's the more of like the edibles or the THC use in the dab pens that are their concern. So we're kind of trying to refresh our activities a little bit too, because there's new trends popping up. I would say, even though we're going in the right way with the old trends, those new trends always pop
you
up.
gotta follow.
So but we're hitting the ground running, going to a school tomorrow to meet with a new advisor too.
Wonderful.
And so it'll be good. It's gonna be a good year. And again, thanks to Provident Health Foundation, we can do this. And not put financial barriers in their way.
Right.
What makes this program especially attractive to us is that it's in 12 school districts.
Right.
So, we can write one check and suddenly we're seeing an impact from, all the way north in Marinette County to all the way north in Menominee County.
Yeah.
So and these are big counties.
Third largest in Wisconsin.
When you see the reach of this program within those schools and those communities, it's wonderful for Provident to be able to take credit for all of their good work.
We'll let you. We'll let you. You awarded us a big grant. We'll let you. Yeah.
Heck yeah.
Couldn't do it without them. Yeah.
So you have recently completed another survey of the kids in our schools to help assess your program. That'd be the police. What have you seen change? Have you seen change or not change in this year's survey?
We've seen great change, and we are as well. I'm doing presentations out to the community with our release, and they are getting ready to do their release too. But we have seen great change in underage drinking rates in our community. E-cigarette use was our biggest drop, which was huge because we've really focused in on that in our action plans, like with the kids and our CTC group. That was one of our main, focuses. And then our marijuana trends it's always kind of been shaky, but our 10th grade use went up just a little bit. So we're keeping our eye on that and seeing what's going on.
Yeah.
We have noticed we did youth focus groups too with our student surveys, and just to make sure we have qualitative data along with our quantitative data. And they really opened our eyes that you have to be asking the questions correctly when you're collecting data on marijuana, because there's so many different forms of it. There's so many different terms for marijuana that kids are not going to say that they're using marijuana if you only say, do you smoke marijuana? So if they consider only THC to be they're not going to say I use,
No.
So there's a lot that we're trying to refigure out on, is our data even maybe valid around marijuana? But we also know everything's changing community-wise, legalization-wise. So we're just kind of trying to get, we might even be collecting more data on that too.
Yeah.
But otherwise, we are excited about the way that the graphs are going in our
That's
direction.
good.
And again, we want to thank the community for all of our agency partners and those who work with us on a lot of what we do, because we couldn't do it alone.
No.
That's for sure.
What's especially attractive for Provident is that, we'll get the question, is our funding having an impact? How do we know that it's working? And we're encouraging all of our grantees to follow the model that HYC has used for a long time, and that is a theory of change.
Right.
What are you trying to change? How are you trying to change it? And how do you know if what you're doing works?
Right.
And so the funding that we have comes with few strings, but one of them is show us if it's working.
Yeah.
We need to be able to
What kind of-
demonstrate
Yep.
that our funds are being used the way that they intend, and to help us accomplish our mission.
Right. What's the impact?
Yep.
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 So how can our listeners support the work and mission of HYC and CTC?
That's a great question. We actually have a lot of opportunities in the community that we need people to participate in. So for one is our HYC Glow Color Blast Fun Run coming up October 11th at Hedges Park in Menominee. It's a great alternative activity, drug and alcohol free activity in the community for families and adults to participate in. It's such a blast, literally, and it helps raise money for our coalition at the same time. So come on out to that. Other different things too. So Crivis is having a parent resource fair tonight in the community. We're bringing what we call our hidden in plain sight teen bedroom. So we just want parents to come on out and learn about different things that are trends for local youth drug and alcohol use too. We're going to have Captain Joe Nault with the Marinette Police Department with our coalition there, and he's going to help lead parents through and educate them. But then we're going to have tables of just information too of what to look for. Just parents to be aware and stay up to date. And our youth focus groups this year, actually, it came out for the second time in a row. Kids, give us a lot of information, and they may be saying, yeah, my mom or dad want to be my best friend, or they provide to me. But then at the end, our last question, and it's open-ended, we don't lead them in any way, but we say, what do you want adults in the community to know about youth drug and alcohol use? It's just open-ended. And even those kids who have said those comments say, be our parent, don't be our friend, don't protect us, give us boundaries. And it's just really eye-opening to hear that from those same kids who maybe said, they provided to us, they want us to be drinking at home or drinking with them, and it's like, wow, they really do want their parent to be their parent. So just kind of, I guess maybe be more involved in your kids' lives, or just come to events that we're doing. We do a lot of parent education events throughout the year. We provide incentives, again, thanks to Provident Health Foundation. We try to provide a light meal or refreshments. We know your lives are busy. We get it. But we provide a lot of really, we think, valuable information at those too. just any way you can to support us that you think. Tell your kids to join Healthy Youth Coalition at their local
Yeah.
school. Most of them are 9 through 12. Some include 7 through 12, but yeah, we would love more members too. Yeah.
Definitely. Definitely. It's great. How about you, John?
Well, we don't fundraise. You know,
Right.
that's we don't compete against our grantees, and I don't have to run duck races anymore. So, but certainly, when you see an opportunity to support an HYC event, a DAR event, any of those events that can use that extra raffle prize or
yeah.
funding support,
Yeah.
you know, raise your hand and say we'd be glad to help out.
Definitely.
Or if you can give an hour of your time a month, our CTC Coalition is always looking for more members. I don't know if we put that out there enough. We talk about it all the time, but we meet virtually, talk to your company if you work during the day to see if you can. We would love to promote them as allowing you to come to. You know, we try to make it easy on people to be involved in that too. So if you're an adult, you want to be a part. You don't just have to be a parent, by the way. I think I've said that word too much, but you can just want to make a difference in your community, and we'll find a place. For you.
You all have time, talent, and treasure.
Yes, there you go.
And this is a great way to share one or two or all of those things with a what's really become a bedrock in our community's efforts to make it a healthier place.
Definitely. Definitely. Well, thanks, guys.
Yeah, thank you
This-
for having us on.
Yeah, this is great information. I mean, just great stuff. I learned so much.
Well, we could have talked for another
I
hour
know,
about everything.
I
as
know you
but-
guys can.
Yeah.
But I'm going to cut you
I
off.
know.
I only have so much time in
I
the
know.
day.
I
No.
know. But thank you for being a supporter too.
Well, absolutely. I totally support everything that you guys do. I mean, and it's a lot. And it's, I mean, if I had that stuff when I was in school, if all of us had that stuff when we were in school.
I know. But we have it now.
I know. That's all that matters,
Yep.
right?
Yep,
Right?
we have it now.
So, all right. Well, hang tight. I think I have one more guest, maybe. If not, I'll see y'all tomorrow. Have a great day.